Mohammed is the head of the Division of Disease Control at the Africa CDC. He's worked in a variety of positions there at the Africa CDC, as well as a variety of positions in his native country of Nigeria. And he was a participant in the webinar that we convened at the UNGA in September 2020, and has been very involved in the response to COVID-19. And I look forward to his remarks. Mohammed. Just go off mute, Mohammed, please.
Can you see my screen?
We can. Just go to slideshow, please.
Okay. Where is that magic?
There we go. You're on. Very good. Thank you.
Thank you. Thank you so much, John. And good morning, good afternoon, good evening to all the participants, depending on where you are. That's one legacy we learned from the COVID-19. Yeah, it's really a great honor and pleasure to talk today in this webinar on the building resilient health system, sharing investment in hepatitis elimination and pandemic preparedness. Okay. Africa CDC, as Dr. John just introduced, is an autonomous health institution of the African Union, established to support health initiatives of our member states. For those who don't know much about Africa CDC, you can go to our website. Africa CDC is a specialized agency. It gets its mandate from the African Union, and we have 5 different regions of the continent where Africa CDC also have regional offices. So Africa CDC is currently developing its internal strategy for HIV, TB, viral hepatitis, malaria, and NTDs. And this roadmap is heavy on delivering the aspirations and goals and objectives of the Cairo Declaration on Viral Hepatitis on the continent. So the Africa CDC Continental Viral Hepatitis Program and Prevention and Control Program is one of the main programs that the Division of Disease Control and Prevention is pushing. It aspires to work collaboratively and catalytically with all stakeholders to eliminate viral hepatitis as a public health threat from the continent through the provision of continental coordination mechanisms, strengthening national public health institutions, and encouraging local manufacturing of consumables, leveraging on existing Africa CDC pool purchasing platform for consumables, and reducing the prices of drugs and consumables for hepatitis, viral hepatitis prevention. It also includes investment in public health workforce and leadership programs, and increased domestic financing and supporting our member states. Very key among all of this is the support for national public health institutions, which include the laboratory. One of the things we learned very clearly from the COVID-19 pandemic is how within 1 year we could make a diagnosis of COVID-19, and you could sit in your house and make a confident diagnosis of COVID-19. And these are the lessons that we hope viral hepatitis prevention and control programs can pick. And now that COVID-19 is winding down, one of the things we hope to do in Africa CDC is see how we can repurpose some of these facilities, some of this capacity that COVID-19 has built into prevention and control of endemic diseases like hepatitis. Of course, prior to COVID-19, there were some challenges within the infectious diseases prevention and control programs on the African continent. One of the main challenges with the laboratory systems, and COVID-19 demonstrated how with the will and courage you can be able to surmount some of these challenges and really get it right, even on the African continent. So the biggest lessons we learned that Africa CDC was able to really support our member states in really vamping up laboratory capacity, especially for COVID-19. We put all of this in what we call our new public health order. And the new public health order in Africa is a roadmap to sustainable health outcomes and health security for the continent. One of the main pillars is strengthening Africa CDC and national public health institutions. And let me use this as an example. During the pandemic, Africa CDC built the capacity and capabilities in member states to strengthen their laboratory system. There was a huge diagnostic capacity that was created in response to COVID-19. And this capacity can now be repurposed, like I said, for the other endemic and infectious diseases. Africa CDC has worked very closely with member states to strengthen their laboratory health systems. And we want to see how what we've done in this area can be used to support the endemic diseases like viral hepatitis. And as you can see at the beginning of the pandemic, the first map of Africa shows there was absolutely no diagnostic capacity in January. In February, when the COVID-19 hit the continent, only 2 countries had the capacity, Senegal and South Africa. But by August 2020, Africa CDC, working with partners, have supported every single member state to be able to make a confident PCR diagnosis of COVID-19. This is a feat that we are very proud of, but we are also looking at how, as NIDA have said, some of this capacity are excess now. How do we ensure that this capacity that we've developed are not just wasted and are used for endemic diseases, which, by the way, are the ones really killing a lot of Africans. So the RESNET program is one of those we are trying to use, which brings laboratory and surveillance networks together, and also try to see how we can build the capacity of some of these labs using the quality assurance and external quality assessment, the SLIMTA program, to support them on the African countries. In this regard, I think we've supported in the Central Africa, we've supported 7 labs who are enrolled on the ISO 1518 accreditation, and more than 200 health laboratory workers were trained. The second pillar is investment in public health workforce and leadership programs to ensure Africa CDC has its workforce as when it is needed. Our member state has the workforce. In this regard, we have several leadership program and the workforce development program that we have done, and all the trainings we've done. We want to see how we can leverage on all of this capacity to support the viral hepatitis prevention and control program on the continent. We need to invest in South-to-South collaboration. Countries have a lot to learn from each other, and they face many challenges and hurdles. Exchange program and this type of platform are what we really need to be able to move this forward. We need also to invest in our community health workers. Africa CDC has work to strengthen community health workers on the continent, to recognize, institutionalize, and be remunerated. But we want to use those community health workers to be not just for pandemic response, but also to be able to support in the prevention and control of viral hepatitis program. For instance, we used the pandemic, during the pandemic, community health workers to scale up massively testing. And this is something I think we can also do. We've seen it used very effectively in Egypt for scaling up of for testing their workforce, not necessarily community health worker, but in other African countries, we think this is something we can do. Local manufacturing is one area that we also hope we can use to expand, especially supply of laboratory consumables. How do we ensure that every person requiring testing for viral hepatitis can get it, and couple it with treatment? And we believe local manufacturing is one area where we need to really be able to develop this. Now, all of what I've said one of the biggest lessons we've learned during the COVID-19 pandemic, and we want to use it for the endemic diseases, is domestic financing and integrated programs. We cannot do much if we as Africans do not rise up and own our health programs, meaning we, with the new DG, we have pushing to have the increased domestic financing for countries to reach their their domestic financing target of 15% of their national budget, and put many of these into endemic diseases, not just pandemics and outbreak response. And of course, we talk about respectful action-oriented partnership, the great partnership that we have with you, John Ward, and other partners in the viral hepatitis elimination program with our member state, Egypt, where we can work together with common goals and common objective, devoid of duplication and inefficiency. I think we will be able to move forward. We have seen challenges of hepatitis testing in the past, challenges of algorithms. At this level, we should be moving closer and closer to point of care testing, utilization, lack of testing policy. 50% of gene expert capacity is on TB, HIV program. It's not utilized, and this is where the capacity is. Can we repurpose some of these gene expert machines to be used for mass campaigns for viral hepatitis? And lack of data to monitor testing volume and results. Of course, cost varies widely from $5 to $200, particularly for PCR testing. But we've seen what COVID-19 has done on the continent of Africa in terms of increasing the capacity for PCR testing and really bringing down the cost of testing. Some of these, we hope, we're already seeing how we can work with the lab division to repurpose this for the use for hepatitis elimination. I've mentioned some of these, so let me just move forward. So the key takeaway is that the COVID-19 pandemic provides the will and pathway to an unprecedented scaling up of laboratory services on the continent. Lessons were learned during the response, and we can use it to fast track what we are doing in the hepatitis elimination. And this is what we hope to push on the continent as the apex continental public health institution. Of course, we have to work, like I said, on logistics and supply chain and break up silos, ensure that there's integration, the TB programs, the HIV programs. Excess capacity can be used for viral hepatitis and other programs, including now that we have COVID, excess capacity. How do we transform them instead of just taking them out of action? Thank you. I'm not sure. I think I took more than the time allocated, but back to you, John.
Thank you very much, Mohammed. Excellent overview, bringing up important opportunities to maintain these transformative improvements in laboratory capacity, as well as the opportunity to break down silos through integrated care. Two important points. Thank you.